Welcome, everyone. We will start in a minute or two. We'll just let the people in before we start. But in the meantime, you can already introduce yourself in the chat box if you want. Who you are, which organization you're representing, and from which country. I'll just start today's webinar while everyone is still rolling in. So welcome everyone to today's webinar. We mark a very special day today, not only because we're finalizing the 16 days of activism, which started with another webinar, which was the third in our Global World Forum series on November 25th on the International Day for the Elimination of Violence Against Women, which is also known as Orange Day. And this webinar, which we started the 16 days of activism with, was incredibly important and very impactful, and it was co-organized with ISUP, GWN, Drug Free America Foundation, and RUN on a very special occasion. And it was just for those who weren't part of that webinar, I would definitely recommend you to go to our website and rewatch the webinar, because it was a global call to action to advance trauma-informed services, SUD services. And during the webinar, our panel, including Johanna Travis Roberts from ISAP, Anja Busse from UNODC, and Rocio Suarez Ordonez from GWN, and our two members, Forhat Hussein from Lido and Daisy Nambunga from UDEL, took part and highlighted the lack of trauma-informed services based on the conducted research and the prevalence of trauma with substance use disorders. And due to their close interlinkage between both, it was very important to offer trauma-informed treatment. And since that isn't done enough, we really called it as a global call to action. So we welcome you to join that global call and find more information on our website. And following the 16 days, we published a post daily as part of our campaign, including best practices by our members in their efforts to combat gender-based violence, strengthen societies, and empower girls and boys to prevent gender-based violence. And even though the 16 days of activism are officially now coming to an end with today, I would like to say that it's only the beginning in our efforts to continue highlighting the needs of women having faced GBV and its correlations with substance use, and advocate for the need for trauma-informed services to provide a holistic and destigmatizing approach for women. And this is perfectly highlighted by today's date, the International Human Rights Day. The Human Rights Day is a reminder that it is our obligation, as well as our state's obligation, to advocate for and provide human rights for all. And this year, the theme announced by the United Nations is Our Rights, Our Future, Right Now. And I believe it's a great message which marks what we advocate for. Not a day should get wasted in advancing the human rights for all, including women facing gender-based violence, children, youth, persons in recovery, and those often marginalized. And when talking about the human rights in context of our work, we often see that the discourse has often become polarized in the international debate, with on the one hand human rights being depicted as the rights to use drugs, and on the other hand a drug-free life as a human right. And this polarization often causes for concern, as the narrative tends to center on a structural level and fails to recognize the realities of the people on the ground. And also, there's not enough available research and statistics from other countries besides the Western world, and it often tends to overlook the different realities faced by people who use drugs from other parts of the world. And There is an urgent need to highlight relevant research from other regions to support the implementation of monitoring and evaluation frameworks for existing programs and include a broader perspective within the drug policy discussion. I would say it is widely recognized that human rights are inherited to all human beings, regardless of race, sex, nationality, ethnicity, language, religious, or any other status. And it's a particularly fundamental human right is the right to health, as the World Health Organization reiterates that health is a legal obligation on states to ensure access to timely, acceptable, and affordable health care. Every person deserves the right to security, access to healthcare services, and obtain medical care while ensuring the respect of their dignity. And with that, I would like to give the word to our International President, Amy Ronshausen, to officially open today's webinar.
Thank you, Cressida, and thank you for that opening. You covered a lot, but I will just cover a little bit to add to that. Welcome, everybody. For any of you who are unfamiliar with WFAD, we are a multilateral community of non-government organizations and individuals who share a common concern that illicit drug use is threatening the existence of stable families, communities, and government institutions throughout the world. We were founded in 2009, and the aim is to strengthen prevention, increase access to treatment, and promote recovery. It is certainly my privilege today to welcome you all to the fourth session of our World Forum webinar series, Global Challenges, Local Solutions. Today's webinar, Best Practices Enhancing the Human Rights to Health, on this very significant day that Cressida has highlighted, Human Rights Day. As we commemorate the adoption of the Universal Declaration of Human Rights, we reaffirm our collective commitment to upholding the inherent dignity and rights of all people. The theme of this webinar speaks directly to two fundamental human rights that are essential for creating a just and thriving society. And two of the issues that we focus on very much at WFAD, the right and access to treatment for substance use disorders, and the right for every child to grow up in a drug-free environment. These rights, the human right to health, they reflect the profound link between public health and human rights. The right to care for substance use disorders is a powerful recognition that addiction is not a moral failing, but a health condition requiring evidence-based treatment, compassion, and support. Substance use disorders affect millions worldwide, touching lives across all socioeconomic groups. Yet far too often, stigma, discrimination, and a lack of resources create barriers to accessing care, leaving individuals and families to suffer in silence. Acknowledging and addressing this gap is not only a public health priority, it is a moral and human rights obligation. Ensuring access to care means advocating for comprehensive systems that prioritize early intervention, long-term recovery support, and the integration into the broader healthcare framework. It means creating environments where individuals feel safe to seek help without fear of judgment, and where recovery is celebrated as a pathway to reclaiming dignity and purpose. Moreover, addressing substance use disorders goes beyond individual health. It strengthens families, revitalizes communities, and reduces the social and economic cost of untreated addiction. When we invest in equitable access of care, we are not only saving lives, but also affirming that no one is beyond hope or help. Equally important is safeguarding the rights of the child. The UN Convention on the Rights of the Child affirms that every child has the right to grow up in an environment that fosters their physical, mental, and emotional well-being. A drug-free upbringing is essential for enabling children to reach their full potential and for building resilient communities that thrive for generations to come. Today's discussion will bring together thought leaders and practitioners and advocates who are dedicated to advancing these crucial human rights. By sharing best practices and innovative approaches, we aim to inspire action and collaboration that strengthens health systems and protects the most vulnerable. Let us use this opportunity to deepen our understanding, to challenge stigma, and to reaffirm our commitment to ensure that the rights of health and its profound implication for treatment and prevention is realized for all. I'm so happy that you guys are all here today for this important dialogue because I believe that together we can make health and dignity a reality for everyone. I will turn it back over to Cressida and we will get started. Thank you.
Thank you so much for your great opening and really stating what today's webinar is about. And like you said, together we make health important and recognized. Before I will introduce our honorable speakers today, I would like to take a brief moment to present you with a human right close to our heart, the Convention on the Right of the Child, which not only states that youth should be protected from the use and trafficking of illicit drugs, it also states that it is their right to participate, and they have the right to self-determination. We always have to remember that while designing and implementing prevention tools or any tools for youth, we are not only looking to improve the child's welfare, but adhere to their right with the principle of the best interest of the child or the youth. The latter can only be determined together with the youth and the child and not by the adult only. And if children and youth are part of determining their rights, they have the right of self-expression, association, and information. And it should be acknowledged that children have the right to be involved in all decisions that impact their lives and take part in decisions of their own reality. And by including children and youth in your efforts, you are not only committing to their right to participate to matters that affect them, but it also ensures that interventions are contextual, tangible, and relevant. And this is imperative for generation as well as sustainable change, as their agency helps children and youth to shift from passive or reactive to being active and enable them to set their own agenda, and it elicits accountability of adults to children. And based on the urge to include children's and youth voices, we are part of a global youth committee whose aim is to amplify these voices of youth on national and international levels. And together, this group, consisting of youth from Pakistan, Kenya, Nigeria, Sweden, United States of America, Sri Lanka, Suriname, and South Africa, we have created a global call to action for youth. What do we aim? We aim to develop a youth declaration designed by youth to present at the international drug policy level, namely the Commission on Narcotic Drugs, which is yearly organized in Vienna at the UNODC building. Our aim is to bring together the experiences, needs, and ideas of youth across countries and cultures so that decision makers hear directly from them, and by defining what young people need for effective substance use prevention, treatment, and recovery. And so we are shaping a youth-centered inclusive vision that prioritizes solutions. And we welcome you to join our global call, to join our movement, and spread the survey, which I soon will share in the chat, among the youth that you know, the youth that you're working with, the youth within your family, the youth within your environment and network in your community, so that they can actually share their perspectives, their needs, everything related to prevention, treatment, and recovery. So we can make the youth declaration be as big as possible to be recognized by those on the higher levels. So I invite you to do that. And yes, as I said, I'll share the link soon. And for that, I will now hand over the words to our dear speakers. So our first speaker, Matej Koshir, who is the director of the Institute for Research and Development, UTRIP. He has been working in prevention and advocacy in the field of alcohol, tobacco, and other drugs for around 25 years in Slovenia. And in 2023, he was elected as the chairperson of the Vienna NGO Committee on Drugs. He was unfortunately not able to join us in person at the moment live, but he did share a video with us with his remarks on today's date, which we'll be sharing now. The sound is not working.
It's not working.
No.
Okay, hold on 1 second.
This vital conversation on best practices enhancing the esteemed panelists, distinguished guests, and attendees from around the globe. I'm honored to join this vital conversation on best practices enhancing the human rights to health as part of WFAD World Forum Series. I'm Matej Košir and I'm from Utrip Institute in Slovenia. My organization is mainly involved in prevention and public health advocacy, but we are also increasingly present on the international scene in the field of drug policy. I apologize for not being able to be with you in person today, because as you are listening to me, I'm on a plane on my way to Brussels for annual meeting of the European Civil Society Forum on Drugs. Today, as we commemorate the International Day of Human Rights and conclude the 16 days of Activism Campaign, I bring a message of urgency, a call to amplify the voices of those who work tirelessly to protect the right to health, prevention, treatment, and recovery, particularly in the realm of drug policy. The right to health is a cornerstone of human dignity. It enshrined it in the Universal Declaration of Human Rights and reinforced by international frameworks like WHO's legal obligations for states to ensure access to healthcare. Yet, as we navigate the complexities of the post-COVID era, this fundamental right faces unprecedented challenges. Escalating conflicts, cross-border trafficking, and the normalization of drug use, especially among youth, have created a landscape fraught with danger and inequality. Now, more than ever, we need comprehensive, evidence-based approaches to address the far-reaching impacts of substance use. I'm with you today to address an important topic, namely ensuring the inclusion of NGOs in the field of prevention, treatment, and recovery in human rights debates on drug policy. We know that at UN level, these debates are predominantly limited to harm reduction NGOs, and this is certainly not a balanced approach. With this in mind, we are taking the initiative to ask the Office of the United Nations High Commissioner for Human Rights to ensure a more balanced approach and discussion. Why is it so important to include NGOs in the field of prevention, treatment, and recovery in human rights debates? These organizations are not just service providers. They're champions of health, human dignity, and social justice. Their work addresses critical gaps in healthcare, combats stigma, and ensures that the most marginalized among us are not left behind. It is then essential that their voices are systematically included in human rights debates on drug policy. Let me illustrate why their inclusion is indispensable. First, NGOs combat stigma and discrimination, which remain some of the most significant barriers to access, treatment, and recovery. By fostering community understanding and making recovery visible, they create environments where individuals can seek help without fear of judgment. Second, they bring gender-sensitive and trauma-informed approaches to the forefront. Women often face unique barriers to access treatment, from caregiving responsibilities to societal stigma. NGOs ensure equitable access to care, empowering women to reclaim their lives and their futures. Third, these organizations are staunch advocates for our youth. Article 33 of the Convention on the Rights of Child guarantees every child's right to grow up in the drug-free environment. Prevention and early intervention programs, often spearheaded by NGOs, are crucial to protecting young people from the devastating long-term effects of substance use. Moreover, NGOs address the needs of families, promote alternatives to incarceration, and advocate for marginalized subgroups, including individuals experiencing homelessness, those with disabilities, and LGBTQIA+ communities. These efforts reflect a profound commitment to justice, equity, and inclusion. As the international community grapples with the synthetic drug crisis and its implications, we must recognize that NGOs' on-the-ground experience and community engagement are invaluable. Their insights can inform policies that are not only effective, but also rooted in human rights principles. Their inclusion is not just beneficial, it is necessary to create balanced, inclusive, and sustainable solutions. I stand with over 70 NGOs and counting who have co-signed the letter to the Office of the High Commissioner for Human Rights, urging the systematic inclusion of prevention, treatment, and recovery organizations in these critical discussions. These organizations are dispensable partners in ensuring that global drug policy protects health, upholds dignity, and fosters recovery. Let us use this forum to reaffirm our commitment to the right to health, not as an abstract ideal, but as a lived reality for all. Let us continue to advocate for policies that center on human rights and prioritize prevention, treatment, and recovery. Together, we can create a world where every individual, regardless of circumstances, has the opportunity to heal, recover, and thrive. Thank you.
Thank you, Matesh. I was gonna say. So yeah, thank you, Matesh, for the great statement. And we do agree we should all jump on board and work together towards the promotion of the human rights to health to ensure that everyone on each level of society has access to services. It has this right for prevention and also just a healthy life. So based on that, I would like to move on to our next speaker. Our next speaker is Syed Zulfikar Hussain, and I apologize if I mispronounce it. He is a renowned consultant and expert anti-narcotic drugs campaign, master trainer on drug use prevention with the UNODC INL, drug DP and Coloma Plan, and working in the field of drug demand reduction. He represents two organizations, Youth Council for Anti-Narcotics and Drug Advisory Training Hub. Thank you for joining us today and looking forward to your presentation.
Hi, can you hear me?
Yes, we can hear you.
Yeah, thank you very much, the organizer who gave opportunity. Today is, the International Human Rights Day. Sorry. What is the Human Rights Day? Human rights are the force for prevention, protection, build a better future. The human rights to health is a fundamental principle that acknowledge every individual in her dignity and worth, regardless of gender. However, numerous global challenges such as poverty, inequality, lack of basic education, climate change, and drug addiction, and access to quality healthcare services. In response to these issues, innovative local solutions are emerging worldwide, showcasing the effectiveness of community-driven approaches to promote health and well-being for all. Human rights article. There are 1 to 30 human rights article. They mention all human rights being are born free and equal in dignity and rights. Right to life, liberty, right to recognition, right to education, right to health, and no torture, etc. The article, I think so. Yes, the article 25 and 26. There are two major articles belong to health and education. Article 25, everyone has the right to stand of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age or other lack of livelihood in circumstances beyond this control. Unfortunately, we are living in the third world country, and everybody knows that those in third world country and what is the human rights and what is the human right violation, and everybody knows. One thing I mentioned here in our according to the national survey on drug use in Pakistan, reported by the United Nation Office of Drugs and Crime, UNODC, and Ministry of Narcotics Control, conducted 2012 and published in Pakistan 2013. According to this survey, 6.7 million people are using drug in Pakistan 12 years before, yeah. And drug addicts people ages between 15 to 65 years. Most addicted are between 25 to 39. And we are discussing on health issue on the Human Rights Day. One thing is very clear. In this survey, in this report 2013, there are only 19 to 90 beds were available for drug treatment. I mean to say 2,000 drug addict who need the facility of treatment in the whole country. Why is prevention of health and social problem important for any nation? Because health is linked to rising income, increased productivity, children education, and adult well-being. I give one example where I'm working. My organization are providing a services outreach program, especially in treatment side for the last 30 years. And I am honestly, we are not committed to the international human rights, articles. One example, in our city, the government hospital number of 6 and the private sector near about 60 plus, and there are only 6 government hospitals in Lahore. Those have psychiatry and addiction ward, but only two hospitals are providing services for the treatment of drug addiction. And the total population over 14 million total number, and 1.5 I think so half million of people are using drugs in the city of Lahore. One hospital is the Punjab Institute of Mental Health. It provided only 100 beds, but occupied on a regular basis 70 to 80. And the new hospital are 20 bed, but the occupied bed only 10 to 12. One thing is very strange for me in the whole life. The duration of treatment provided by these institutes and with the government sector are only 15 to 20 days, and after 15 or 20 days the doctor and the hospital management discharge the patient. Barriers to healthcare for drug users: limited access to healthcare services, less number of public hospital, and female have less availability of beds. One thing very clear, in Pakistan, I have no idea, but I believe that, and my observation, no as a separate hospital for female drug addicts in the Pakistan. Stigma and discrimination, public humiliation and feeling underserved. The new trend of being cool with drugs like vaping, nicotine patches, ice, and other drugs. Yeah, socio-economic factor is a main part of poverty, influence, less supportive environment, incompetent healthcare body, non-ethical practices, no up to date learning, less fund given to initiate drug reduction and treatment, drug demand reduction and treatment, Funds are the main reason third world countries to build better communities. Legal obligation, political and law is totally weak. Community approaches to drug usage reduction. Importance of involving local communities, healthcare providers and policymakers in drug education initiative. The role of local healthcare providers and volunteers collaborate together and make a better workflow system. Both gender discrimination, gender should be taken into consideration. Local initiative, individual responsibility taken by the community. Financing for drug users, social health insurance scheme to help people access healthcare easily. But in our country, we have no any system, any policy to help the a substance use disorder who using soft drug. Community-based health funds generate fund accounts to help those who cannot afford. Most of 60 to 70% our community, those who are using drugs, they have no funding opportunity to support get the treatment side. Government and private sector collaboration combine and make healthy initiatives is a main important. Strengthening health system, significance of strengthening primary healthcare, making a component body to assess the first aid a drug user needs. Integration addiction treatment, incorporate plans of addiction treatment, increasing the availability of holistically trained group of addiction specialists. Digital health tool. Digital health tool services are very important, and helpline service is a very important. Policy implication and recommendation. Current local policies related to drug use and health is a very important in the community to save the young generation from drugs. Recommendation to policymakers: provide for stronger government investment, advocate for strong government investment in SUD and harm reduction program, implementation of law that protect the health rights of individuals with substance use disorder, call for more inclusive policies that address the need of marginalized people. Importance of community engagement, sustainable financing, and strengthening health system to address the human rights, to help the individual with substance use disorder. Priority-wise, I think so. Human rights to help for people with substance use disorder can lead to healthcare, more equitable society. This is my opinion on this day. The theme of this day, our right, our future, and right now. But I have already said that we are living in the third world country, and nobody can understand what is the right and what is the wrong. Thank you very much.
Thank you so much for your valuable presentation. Could you maybe stop sharing your screen?
Yeah.
No problem. Thank you. Yes, thank you for providing us with the overview of what you said, the third world country, because as I said earlier, this is often not considered, it's often forgotten, and there's always different perspectives everywhere around the world as well. But also that you very much highlighted the need for human rights, and also that it should be integrated in health systems, that there's currently not enough at the moment. Like there's many that would need, for example, treatment, but there's just a lack of services, especially when it comes to gender sensitized services, and there's a lot of this stigma and discrimination. So that is something we have to work on, but you also gave some great solutions on how to strengthen the health system. So thank you for that and being with us today on this important day. Thank you. Then for the next speaker, I would like to introduce Srishti Dubey. She is a passionate social work professional dedicated to empower marginalized communities and advocating for human rights. She has an extensive experience in the development sector. She's currently a project associate and a secretary of Global Alliance for Human Rights. Her initiatives focus on improving the lives of people living with HIV, children living with HIV, and women living with HIV. Srishti, the floor is yours.
Thank you, Cressida, for inviting me. I'll just start sharing my screen.
You can go on the arrows all the way back. Yeah, or like that.
Okay. Okay, thank you. I would like to start my presentation by saying the doctors in my village didn't even check my wife's pulse when she was serious, recounts Ishan, his distress baby. Ishan and his wife, Geeta, are among the 2.4 million people living with HIV/AIDS in India. Stigma and discrimination remain a significant challenge for them, impacting their physical and mental well-being. The community faces stigma starting from themselves, impacting their within the healthcare facilities, at the social level, and legal and policy level barriers. I had to take her all the way to Jaipur where she underwent surgery. Even there, she noticed a change in attitude when the nursing staff learned that she was linked with HIV/AIDS. Ishan adds. India is among the first few countries to enact legislation protecting people living with HIV/AIDS against discrimination and safeguarding their interests and rights. The HIV and AIDS Prevention and Control Act 2017 introduced two robust measures to eradicate stigma and discrimination across various sectors, including healthcare, education, and the workplace, and safeguard the rights of PL-HIV and P population. The National AIDS Control Organization, under the Ministry of Health and Family Welfare, Government of India, has adopted treat and test policy providing free antiretroviral therapy in public health hospitals for people living with HIV/AIDS. Despite these measures, discrimination persists. There have been numerous instances where affected people have taken extreme steps like suicide or isolated themselves because of constant discrimination from the society, says Ms. Ashoka Roy, Secretary of Jaipur District Legal Service Authority. Moving further, to enable people living with HIV/AIDS and key population to access services, raise awareness, and provide linkage to legal aid, Global Alliance for Human Rights India, a organization in collaboration with UNDP in India, Rajasthan State Legal Aid Service Organization, the National AIDS Control Organization, Jaipur District Legal Service Organization have initiated a dedicated legal aid clinic in Jaipur and Bharatpur district in Rajasthan, India. DLAC is one of the first kind of initiative uh, in the state of India, Rajasthan, to provide legal redress in case of violation and discrimination, raising awareness about the rights under the HIV Act and lightening with the legal community and forums such as Lok Adalat, an alternative dispute redressal mechanism where disputes and cases pending in the court of law are settled amicably, and district and block level departments. It also sensitizes stakeholders such as paralegal volunteers about their responsibilities towards these vulnerable groups under the Act. While the HIV and AIDS is in place, we still need to create awareness about how it safeguards the rights of people living with HIV/AIDS against discrimination. DLAC is helping them to become aware about their rights and safeguard them. And whenever their right is being violated, be it hospitals, schools, government offices, or even their homes, DLAC provides them support through District Legal Service Authority. Chair Brijesh Kumar Dubey, who is the founder of Global Alliance for Human Rights India. In association to this, we have also proudly we are saying that we have done 100 plus legal aid cases interventions among people living with HIV/AIDS, children who are living with HIV/AIDS, LGBTQI plus community under this act, and also transgender bill which was passed in 2019. We have also established community counseling centers providing a safe environment for individual resilience and their self-resilience, self-determination. They also sensitizes a young population, that is the children and colleges, around 1,000 to 1,500 children, or across within the span of 6 months of this climate project. Our one of the major initiative was Padyatra, which is it's a Hindi word. In English, we say barefoot walk from all the way to Rajasthan to Delhi, which is the capital of India. And in that, we have sensitized all the people, all the municipality, panchayats, district courts, and also school children, police stations, etc. It is a small glimpse of the video. I would like to.
We don't have sound, but I think that should be okay.
All like video clips of how we went all the way to like, barefoot. We went to sensitize the people to raise awareness about this act, which the government of India has provided to us. And then these are the small pictures, glimpse of like our Padyatra, that is barefoot walk. And these are the our like glimpse of our interventions with children, school children, people, and our clients, women, transgender community, etc. These are again small glimpse of our community healthcare. We have also like went to 25th AIDS conference, which held in Zurich in Germany, and also Bangkok for the 10-10 plus targets to achieve through end discrimination against AIDS. And there is some small video on YouTube. It's available on YouTube. If with your permission, Chazada, can I open just a glimpse of it? I will show.
Sure, if you're able to also share it with sound, and otherwise, yeah.
So it will I'll be able to share. Sound is coming.
We don't see the video right now. We just see the presentation.
It's okay. I'll share the link of that video in the group. It's on YouTube.
Great.
So
yes, you can share it in the chat.
And to end my presentation, I want to just end by saying since 2014, our organization has been working with Ministries of Health, UNICEF, UNDP, UNAIDS, and a community group within over 50 districts of Rajasthan to roll out our major aim to end discrimination against HIV and inclusion of LGBTQI plus community in and around Rajasthan. And initiatives like DLAC are a step forward to help vulnerable communities to fight, like people living with HIV/AIDS, LGBTQI plus community, to find discrimination and support that nobody is left behind. So that's all for my presentation. Thank you so much, everyone, for listening.
Cressida, you're muted.
Thank you. Thank you for your presentation, I was saying, and for your sharing your important work, especially if, people that, as you said, are often marginalized, stigmatized, and therefore very much isolated from their community, people living with HIV, and that their right is very much important to be upheld, and also that for them to teach about their right, because oftentimes when you're so stigmatized, you forget about your own rights. So thank you for your great work in doing that. And the barefoot walk is definitely something impressive. So thank you for doing that. I'm very much looking forward to the video you'll be sharing in the chat
That was the
soon.
initiative by my father. He's Brajesh Dubey. He fought all the odd odds to get permission from municipality, police, and all to get this thing done, because we believe that people should know, should be aware about so their own rights. So that's it.
That's amazing. Thank you so much. That is a really great initiative. Congrats to your dad also to make it work. Thank you. So before we move on, I think I would like to thank thank you again, Shristi, and also to remind everyone who is attending that feel free to ask questions. We will be going through all the questions after the last presentation, so you can share them in either the chat or in the Q&A box. So without further ado, I would like to introduce Shinasa Shahid. She is a final year researcher at the University of Derby, studying addiction recovery experiences in the Afro-Caribbean and South Asian women. She's an advisor for local peer support groups, creating accessibility for recovery for ethnic groups. And she's also a counseling psychologist with over 5 years of experience in counseling and community outreach. She is a passionate advocate for research in addiction recovery in ethnic women and emotional wellness. Shinasa, the floor is yours.
Thank you. Thank you so much. Please share my screen. So I hope my screen is visible to everybody.
Yes, it is.
Right. So before I start with the main slide, I wanted to touch upon a very significant and a beautiful word here. And the word is culture. So if we think of a culture iceberg, the top bit, the visible part, we see, or we understand that the top bit is language, clothes, music, art, food, things that are visible. So now the bottom part, the crucial and the invisible part of iceberg consists of cultural values, beliefs, identity, intergenerational migration trauma. By that, I mean, so for example, Indians were colonized by the British, and then some went to Africa, to another colony by the same colonizer. And then they went to the country of the colonizer, UK. So by the time they got to the UK, the kind of knowledge that was being passed from their grandparents had 3 different versions of living under the British rule that came with a lot of trauma. So this is just an example. And there are many such invisible elements and core components of culture that affect ethnic people today that others don't really see or know about. Hi, my name is Shanasa. I'm a third-year PhD student at the University of Derby in the UK, and I'm here to present my paper on exploring cultural dynamics of Black, Asian, ethnic minority women in addiction recovery. Oh, I'm unable to go to the next slide. Oh, okay. So I managed to get a couple of news clips on how addiction is affecting the ethnic communities in the UK. Addiction is not just a health issue here, it's a social issue. It strains the fabric of our society. It can divide families, it can ruin childhood, can affect mental health, and even fuel crime. So substance addiction recovery is a journey where people take charge of their own lives to get healthier and feel better. It's about making positive changes to improve the overall well-being and living a fulfilling life. So we found that previous studies have focused largely on the white culture, and studies conducted on other ethnic groups have found that cultural aspects and barriers like shame and stigma, or being underrepresented in the services, taking care of the dignity and family honor, these things play a huge role in shaping their recovery pathways. But if we look at a bit of a stats here, 11.7% of ethnic people use illicit drugs in the UK, and yet not even 1% of the total number of people are being treated. Substance use affects ethnic people and white people equally, but this disparity between substance use and addiction treatment in the ethnic communities is quite concerning. The next stats show 70% of white professionals and doctors said that they were uncomfortable to deal with people from different ethnic background, which is even more concerning. So to explore this, our objective was to compare the recovery pathways of ethnic women in the UK. And to do this, we use two frameworks. One is the recovery capital framework that refers to the total internal and external resources a person can access to initiate and maintain recovery. So for example, if a person who is in recovery is unemployed, is still cut off from a healthy social circle, her recovery capital is low. But if the same person gets a job and is back with her family or kids and connects with a support group, her recovery capital increases. The other framework is the CHIME-D framework, which stands for connectedness, hope or optimism, identity, meaning, empowerment, and D stands for difficulties. Data was collected through interviews and surveys, and at that stage, I reached out to 3 different recovery organizations in the UK to recruit 3 women. Jazz was the South Asian woman, Laura was the Afro-Caribbean woman, and Sharon was the white woman. The quantitative method we used was the RECCAP questionnaire, the recovery capital RECCAP questionnaire, to measure and track recovery, as in how people are doing in their recovery journey. In the qualitative phase, I developed semi-structured interview questions. After analyzing the data, I shared the findings with each of the 3 participants. We received positive feedback. So this was another invaluable part of my study where it helped where my participants feel part of the research process. Here I present the results. The first table shows the quantitative results, and we can see that Jazz, the South Asian woman, scored the highest overall recovery capital score with 0 barriers. This was followed by Laura and then Sharon. We also need to recognize that only Jazz was supported by a culturally tailored recovery service here. In the comparison table below, we see that all of them approached recovery services. They focused on working on their well-being, rebuilding their identity, reconnecting socially, and they all aspired to maintain their recovery. Interestingly, they also preferred local support services over mainstream drug and alcohol services. However, their motivations to recovery was different. Jazz and Laura, the 2 ethnic women, were driven by motherhood. The white woman was driven by her desire to regain her independence. Only Jazz and Sharon were they participated in meaningful activities like volunteering and giving back to the society. The Afro-Caribbean lady couldn't, because she felt that she has to work on herself first, and she was somewhat still struggling in her recovery journey. Ethnic women faced different kinds of barriers, struggling with shame, patriarchy, and feeling that treatment services aren't culturally appropriate. While the white woman pointed out issues like poor communication within and between the recovery services and local services shutting down because of lack of funding that affected her recovery. So what helps ethnic women sustain their recovery? So what we found that services that are culturally tailored and are open 24/7, especially during the holidays and weekends, that works and that helps them. Next, person-centric trauma care services that provides options to choose from and have resources that can help people deal with trauma. That's called trauma care and not just trauma informed. Third, the services should be run by ethnic people with lived experiences because it offers empathy, it offers understanding, and most importantly, reduces stigma. Next, as we have seen in the South Asian lady's case, taking part in volunteering and community service helps them to maintain their addiction recovery. For family support is of utmost importance to them, and faith and spirituality really helps them. Like, for example, prayers and mindfulness practices were of great help. And because of such practices, Jazz, the South Asian woman, was able to tap into them anytime and was able to bring those tools to play when she had a difficult time. I wanted to go a little deeper and understand why are ethnic women not seeking help. Shame and stigma are huge in these communities. I wanted to share an audio clip from one of the ethnic participants here, and I hope you're all able to hear it.
Especially from my community and my culture, I feel like still women, there aren't many women are coming out and talking about the problems that they're having. Stigma, shame is still massive in the community. Sort of men feeling like they can undermine the women and make them feel like, you know what, it's the home thing. Just keep it under wraps. We don't want anyone to know because of the embarrassment and the shame. And Parliament Birmingham contacted myself and said they were going to do a conference and they were going to talk about Asian women and alcohol, because the funeral had found that there was a high number of Asian women with alcohol death-related, deaths, and it was a big issue in the community, and no one was talking about it. You know, the temple, you go to the temples, are saying everything's okay. Oh no, it's not in our community. We don't have a problem. No, it's just the men. It's not the women. If you see, it's a big thing on the women now. Alcohol is massive, absolutely massive, because it's easy to justify if you can have it in the house because you can use it as, okay, the man's having it, or the father's having it, the brother's having it, but really it's around you. But alcohol has become a very big problem for women, especially from my
managing between within the family. So ethnic communities in the UK are very close-knit communities where everybody knows everyone. And because of this stigma, they want to manage it within the four walls. Some families even send their loved ones back to their home countries like India or Pakistan for treatment. We need to understand that the opposite of addiction is connection. People need to know that recovery takes place in a community and not just within the four walls. Racial discrimination and negative past experiences, where people began to develop mistrust in the system because of discrimination. They also felt judged by the doctors because there was no authentic connection, and they felt treated like a number.
Because we get put off, we just get put off, and to get the support that we need to either get funding to go into a rehab and get the support we need, it's hard for us to get it. And when we try and express ourselves, they say we've got attitude, where we come across as intimidating, or we're using manipulation to try and win a place or win funding. There's always something that we're doing that is intimidating them, whether it's the way we talk, whether it's the way we express ourselves. But that's why there's not so much Black people in recovery, because
Lack of culture is a sensitive treatment where traditional models are at play that only serves only the dominant culture. Let's listen to that experience.
Was Amy Winehouse actually, and look, her lyrics and her, what she went through, and oh yeah, so if you're getting those thoughts, just put some music on and listen to the lyrics of Amy Winehouse or something. It was just very much, okay, that's not really going to work. Am I really going to think about, okay, how much am I drinking? And I'm going to write it down and remember this after my, the second, third bottle or whatever, So I just felt like it wasn't real. There's not that warmth, the empathy, the compassion, the understanding. There's such a barrier. It's like very clinical, and it doesn't help when no one has an experience of what you've been through to relate, to emphasize through that experience. So they are barriers, and they're still lacking.
So, to conclude, recovery is a very personal and a unique journey that relies heavily on social support, access to cultural and community resources. For the ethnic groups, motherhood motivated them to change their negative behaviors. The South Asian and the white women found volunteering important to sustain their recovery. And all the three women focused on embracing themselves, using community resources wherever possible. And they all preferred peer support over mainstream treatment. The limitation of my study was it was a very small sample size. And secondly, the three women were in different recovery phases. The South Asian woman was in a long-term recovery. The Afro-Caribbean and the white women were in their initial recovery phases. There is so much that needs to be done. At the policy level, we need to develop policies that ensure equal power sharing on the expert panels, where BAME people, the ethnic people, have the autonomy to introduce new topics or concerns and prevent processes from becoming just tick box exercises. Introduce co-chairing models where ethnic women with lived experience have leadership roles in expert panels. At the service level, we need more women-only groups where they feel safe, they feel heard, and they can share their experiences. Services should also think about helping the families to cope with addiction along with the individual, because families do not know where to go for help because of the lack of awareness, and utilize social media, create podcasts to spread awareness and talk about lived experiences. And lastly, ethnic communities are not hard to reach. They are under-researched. Mainstream services need to understand that one size approach does not fit all, because for factors like language barriers, discrimination, and significant cultural differences make it hard for them to get the right help. Thank you.
Thank you. Thank you so much for your really important research that you have now presented for us. And I don't know, have you already finished the research, or are you still working on the research?
So this was a pilot which I have already published. I'm almost towards the end of my PhD journey. Most probably I'll be submitting my thesis in 2 months. So yeah.
It's really wonderful. I think you pointed out some really good points in the sense that with culture, the connection with culture, and it goes so much deeper than we often think. We often think of one generation, 2 generations, but it goes way more beyond that, and that it can affect until, it can still affect us in some kind of, as you said, stigmatization, shame, and also just the way that the society lives because of the cultural background, and that it plays a huge role as well. And also, thank you for highlighting that and contributing with your research to this underrepresented group in that sense, to make their voices heard, and also showcase that it is important to, consider the different cultures and ethnic backgrounds and the different experiences as well. And so we can actually work on services that open the doors a bit more and open their perspectives a bit more. So thank you so much for that
Thank you.
for that contribution. There's one question in the Q&A to all presenters. It's from Damali Lucas, and it says, "What are the support do you have to support the children of WUD and IGA activities, and how do you do it?" I think WUD is women using drugs, and IGA, I'm not sure about the short for IGA. Does any of the speakers have an answer or would like to contribute to the question? No? Maybe you can think about. There's one more question. See it? Is it you're showing your screen? Would you like to provide an answer to the question? How you support the children of women using drugs and IG activities?
I think so. What is IGA activity? The children's sporting program is
income generating activities.
Income generating income generating program. The first one is a children treatment program. Yeah. The children treatment program is totally different because the I give one example in our country. I already mentioned in the whole country no treatment facility for the women and especially children. One or two organization 3 or 4 years back, they starting the children treatment program. But I think so when the project is finished and the project is totally finished, the age group is a bracket is coming down. First, in our country, they starting age 17, 18, but now you come down, and now at the moment the children are starting 13 years and 14 years. They are using drugs. I think so. The government level and the private sector and the other non-government organization must start in treatment facility for the especially children. Colombo Plan and the UNODC have already a brief program for the children advocacy, children treatment program, and recovery program. I think so. If the government is not working many part of the world, but the private sector and non-government organization is responsible to start, for treatment program and the other. And the income generating program, is a very difficult. Well, I give one example. We started one program. Those person our outreach program. Those person who are using drug and the husband and the head of the family involved in drugs, but the woman need the money. We starting one stitching school, and we provide the 3-month training, 3 to 4 month training. Then she passed and we give one machine for knitting a cloth in the home. This is an income generate program for those family who are involved drugs and the member of the SUD.
Thank you.
Yes.
Thank you for elaborating on the question. Yes, thank you. Also, Srishri, do do you have any activities in your organization for like income generating activities for the women that you're working with or the people with living with HIV? Do you work only with the legal support or also income generating activities?
Mhm. Thank you for the question. Yes, we do have. We actually we follow the framework of Kudumshri, which is a framework which is used in south of India. You came to Kochi, you remember like there is self finance. So what we do is like whatever skill they are good in, we train them. We can try to connect them, and under like our organization there is Positive Ladli network, which is centered towards women, youth women. So what do we do is like whatever, like what if they want to study like study more, or they want to work in a certain like hotel management or banking sector, because most of the women or young girls who comes to us, they are living with HIV/AIDS, or they are divorcee. The family doesn't want them because of the status. So that's why we try to connect it with the organization, for example Azim Premji Foundation, and then CSR initiatives, so that they they collaborate with the skill development program. So we act as a mediator in the between to try to connect them to any sort of organization for the skill development or income generation. So it helps them increasing their income and also skill development programs. So that's what we do, like act as a mediator among like CSR. It's a corporate social responsibility, which is a mandate in India, that 2% of the revenue has to be given to the social development projects, etc. So yeah.
Great, thank you so much. That is a really good initiative, and also to, be a mediator, it's so important, and to make sure that, the skills can be built. So great, thank you so much. There is one more question or two more questions in the chat. One of them is like, what is the role of religion in promoting the rights of recovering persons in recovery? And I think another question which would be maybe related to that, and I think it might be connected to your presentation, Shinasa, is that most African culture value the use of the drugs like alcohol in their ritual, and gradually these practices lead to addiction. Which approach can we use to explain the effect of the use of alcohol without offending these cultures that they value and cherish most?
Let me just go through that question once again. Sorry. Culture value the use of these drugs like alcohol in the ritual, and gradually these practices lead to addiction. Which approach can we use to explain the effect of alcohol use without offending these cultures? And okay, so to be honest, I don't know the answer to this question, because my study was on recovery and not on the addiction of it.
Yeah.
So I don't think I'll be able to answer this question.
That's okay, I understand. Otherwise, what is the role of religion in promoting the rights of recovery? Have you seen that in your research as well, the role of religion?
Yes, the religion plays a big role in the South Asian and the African Caribbean culture, and religion also helps them to initiate and sustain recovery. Also, there is a saying in our culture: when you have nobody, you have God. So when they are unable to see that there is, when they see that there is nobody to help them, because recovery services are mostly for the white, they don't see any people of color in the services. So for them, then the faith is everything to them. Religion helps them to initiate their recovery.
Yes, thank you so much. I've heard that a lot as well, talking to persons, that religion is a big supporter in that sense. See it? You wanted to add?
Yeah. I am also at the one thing. This is a very important question about the religion. Our religion, Islam. Islam is a totally a ban. Islam is a complete code of life who totally disagree those person who are using drugs and other, alcohol and new type of drugs. But we right now at the moment, our system is totally different. People, billion drug user in Pakistan and accept alcohol. 2013 survey, but now after 12 years, being as expert, the population increased and the new trend of addiction also increased. And at the moment, 10 million people are using, drugs in Pakistan at the moment. And I always believe that religion is the main, not only main step, but the end of step to get rid of drugs and recovery program, give strong messages, but people don't understand and don't realize. And one thing, question for Pakistan, what type of drug is mostly abused in Pakistan? There are two types of drugs in Pakistan, and I elaborate. One is a hard drug and one is a soft drug. Hard drugs, you decrease the life, and soft drugs not decrease the life immediately. Hard drugs mean ice, ecstasy, LSD tablet, cocaine, and some injection. And the soft drugs, opium, alcohol, cannabis, some pharmaceutical drugs, and vaping is also people are using in vape, ice water and some nicotine patches. They are soft drug in Pakistan. People are, and 30 to 40% people, young generation, are using all these kind of drugs.
Thank you for answering the question. I was gonna ask you the question indeed. I saw it in the chat. So yeah, thank you so much. I don't see any more questions, but I would like to thank all of the speakers for joining us today, for sharing your work, sharing your research, and sharing the importance of sharing the importance of human rights for all. I think that's today's theme, and all your work is kind of, contributing to that overlapping framework that we are highlighting today. So I would like to thank you for joining us today, and I would like to thank all the attendees as well for joining us and staying on until the end. The recordings, they will be shared later this week, as well as a summary. So keep an eye on your email address. And I saw some of you already shared the request for the certificates, and we've also sent that in the email for certificate of participation for all that would like to have one. So for now, I would like to use the opportunity to close the webinar. And as I said, thank all of you for joining us today. We very much are happy to close the Global World Forum series with such a powerful event. And we wish you a very beautiful December ahead. Wherever you may be, some of you might be celebrating under the sun and some of you with snow, whichever corner of the world you are in, and we wish you very much of a happy new year as well in advance. So thank you for joining, and we'll keep in touch. Thank you.
Thank you very much. Yeah.